Namaste, welcome you all to our new episode of Health Heroes of India. Today, the topic of discussion is the role of endocrinologist in diabetic foot. So, before going to discuss on the topic, as you know, in Health Heroes of India, we discuss with different topic, health related topic, and we come across to decode it. What are the things patient should do, patient should not do, and how it will be helpful for you. So everything will come in detail. So for to discuss on this topic today, we have invited our guest, Dr. Harsha. Dr. Harsha is a endocrinologist practicing in Visakhapatnam. He is practicing here in Visakhapatnam since 13 years, and he has seen a lot of patients every day. His total clinic is full busy with the patient of diabetics. So let's welcome him to our podcast and ask the questions what is very necessary and for the general people and for the common people. Let's welcome sir.
Namaste, and thank you very much for inviting me for this podcast.
So today we are going to discuss about diabetic food conditions and how endocrinology will help the diabetic. Yes. And what are the things? So many things we'll discuss on this particular discussion. Sir, as you're practicing here in Visakhapatnam since 13 years and you have been consulted a lot of patients of diabetic. What is endocrinology and how it differ from physician?
That's a very good question. So there is a lot of doubt in the general public that how an endocrinologist is different from physician. So people are not able to differentiate what is an endocrinology, what is general physician, and how they are different.
Yes.
So we have to understand the structure of the medical education. First, students complete 6 years of MBBS. Then they write post-graduation exam. Then some people move into general physician, that is MD.
Okay.
After completing MD, they do super specialization, that is for another 3 years. So the general physicians who appear for the super specialty exam and opt endocrinology, they become endocrinologist. So specialty is general medicine or general physician, and endocrinology is level above general physician. So it is super specialty. So general physician completes 6 plus 3 years of education to become a doctor.
Okay.
Endocrinologist completes 6 plus 3 plus 3. So 12 years. Okay. And he specializes in treating hormones and hormone related problems like diabetes, thyroid, growth, obesity, PCOD, hypogonadism, and osteoporosis, problems related to calcium, phosphorus, weak bones, and many other things.
Okay.
But mostly what people know is endocrinologists treat thyroid and diabetes, but there is beyond that to endocrinology. Hypogonadism is decreased functioning of the gonads. Gonads. So the sex hormones.
Gonads means what is this?
Gonads are testes in males and ovaries in females.
Okay.
So if they don't function properly, females may have irregular cycles, irregular menses, and males may lose the interest in personal life.
Okay.
So that is gonad. So
okay, this is also vital things.
This is a very common problem, but people, they don't want to explain, and they don't want to consult a doctor many a times.
Main thing is that it's because of people not aware about all this.
Yes, people are not aware. Absolutely, they are not aware. They don't know whom to consult.
Yes, whom to consult and which doctor they should go for, and how many days the treatment should go for. So nothing. There is a lack of awareness, and here we are. That's why we are here for.
People expect instant results, and sometimes in many branches of medicine that's not possible.
Okay.
Instant relief, it's not possible. It will take time. Yes.
Sir, so since 13 years you are consulting so many patients. So my question is that how you treat the diabetic patients?
Okay. So not everyone is the same. Not all patients are the same. Each patient is a total new experience for us. So we treat all aspects of diabetes and its complications from A to Z. And our job is not only treat, our job is also identify the complications of diabetes at the earliest.
Okay.
So our job is to prevent more than treat. If it is too late, we emphasize on treatment and we need to pick up the complications early. So like diabetic kidney disease and diabetic eye disease, prevention is a lot more worth than treating the problem.
Okay. So once a person is suffering with diabetic, then what are the common health related issue he or she will face in a later stage of life?
Yeah. So this is a very misconception that once somebody develops diabetes, he will develop kidney disease, he will develop nerve problems, he will need to amputate later in life. Yes, that happens in many people, but let me make this point very clear that if the patient with diabetes has his sugar levels under control right from day one, as soon as he is diagnosed, he can live just a normal, healthy life just like any other person. He will not develop neuropathy, he will not develop retinopathy, he will not develop nephropathy, he will not develop any complication of any other organ. Indeed, I have patients who have been diabetic for 40, 50 years and still they don't have any complications of diabetes. So everything points out to this one thing, that keep your sugar levels in control right from day one.
Okay.
Then you are assured that you will not have any complication of diabetes. But however, in India, because of many false news and all, people think I was diagnosed very recently, let me wait for 2 or 3 years, what will happen? Because he doesn't have symptoms.
Mm-hmm.
So he will wait for 2 or 3 years, even though the sugars are high for 2 or 3 years.
Okay.
He just neglects, I'm a very young age, why should I take medicine? Young age medicine does harm to my body. So if I start from now, I have to take it lifelong.
Mm-hmm.
So this is one big thing, that patients somehow they are misguided by their elders, friends or neighbors who are not at all medically qualified people to not to use medications. And once they develop symptoms of diabetes, half of the damage is already done.
Okay.
So if somebody develops neuropathy, it means 50% of nerves are gone.
So you told that if you find any kind of symptoms, yearly medications or yearly diagnosis has to be done.
Yes.
So how, because basically the people's, until unless they feel any kind of symptoms,
Yes.
it's latter stage of life, like after 40 or 45, they come to know that I am suffering with diabetes.
Yes.
What are the symptoms basically the people will get are the early symptoms what they will get?
Yeah, so we have to understand this, that diabetic patients, they did not have any symptoms.
Mm-hmm.
So how do we catch them is to test them annually. Any person beyond the age of 20 or 25 years, it is advised to get sugar test done at least yearly once.
Yearly ones.
So if they don't have symptoms, they will get picked up by these blood tests.
Okay.
Nowadays, diabetes is becoming common even in the 20s. Early 20s also, many people are getting affected with diabetes.
Okay.
On the other extreme side, we have patients who have all classical manifestations of diabetes, that they will pass more urine at night time. They have more thirst, they lose weight, they have weakness, they have cramps all night.
Mm-hmm.
And unfortunately, some people will also develop some urine infections, especially females after their menopause. Some people can develop blurring of vision. So pictures which were clear, they start to blur.
Yes.
So people think it is just a change in my eyesight. So any person who experiences change in their rapid change in their eyesight, power of lenses, they should always check for blood glucose levels. So vaguely, if you want me to summarize, it's like weight loss, weakness, cramps, increased thirst, increased urination, increased hunger,
Okay.
and frequent urinary infections, and visual symptoms like blurring of vision and all.
Okay, these are the symptoms
Of diabetes.
Yearly symptoms.
These are not necessarily early symptoms. Early diabetes, they doesn't have any symptoms. That's
Okay.
the problem with diabetes. If the sugars are not persistently high, they are just like, say, if you 150 or 180, people need not have any symptoms. So that's why it doesn't cost much to test anyone. Nowadays, even the government vehicles which come to the village, they do free glucose testing. So
Yes.
everyone should get tested for diabetes after they cross 20 years at least. So no age is immune from diabetes. So the best thing to do is to get tested for diabetes.
Okay. What are the basic primary hormones that are involved in regulation of sugar in blood?
Yeah. Okay. So blood sugar regulation is very important. Suppose if we don't eat for 1 or 2 days, our body sugars will not become low.
Okay.
In normal persons, I mean. And normal person, if he consumes 10 ice creams at a time, his body sugars will not become 500.
Okay.
Normal person.
Okay.
I'm not talking about diabetic. Even if children, they eat 5-6 ice creams at one single go.
Yes.
They don't develop diabetes just like that. So there are hormones which keep sugar level in control. So one important hormone is insulin. Insulin. So insulin is produced in the pancreas. So insulin is produced normally to keep blood glucose levels in control. And if we eat something that has both carbohydrates and protein, insulin levels also increase, and they see that this blood glucose doesn't go beyond some point.
Okay.
So insulin will keep the blood glucose levels in check. So if the blood glucose levels rise, insulin levels will rise, and they bring down the blood glucose to normal. On the other hand side, if we are fasting for some time, our blood sugars levels will not go low.
Okay.
It is because there are other hormones known as counter-regulatory hormones like glucagon, epinephrine, cortisol, growth hormone. These things increase your glucose levels. So in normal healthy people, the balance between insulin and counter-regulatory hormones that I had suggested helps to keep the glucose levels in balance.
Okay.
And this balance is disturbed in diabetic people. So they have high glucose levels.
Sir, in diabetic food, basically neuropathy is a biggest complication.
Yes.
So how do you manage as an endocrinologist? How do you manage?
So diabetic foot, one of the prerequisites to develop diabetic foot is neuropathy.
Okay.
So without neuropathy, it's very unlikely to develop diabetic foot.
Okay.
So neuropathy is again the nerves that go to the legs and feet, or long-standing diabetes, they are damaged. So they don't serve their purpose of carrying all the sensations and all. So even if somebody has a prick to the foot, the sensation they cannot pick up. So neuropathic patient, they have numbness of feet.
Yes.
They can't experience pain, they can't experience touch. And if they walk in dark, they can sway and they can fall also because they lose their balance.
Yes.
So to pick up neuropathy, we should examine the feet at every visit.
Okay.
And the best thing is to use a 10-gram monofilament and do testing.
Okay.
And if you feel that the person is not able to perceive the sensation, it means he might have developed neuropathy, and that person is at very high risk of developing diabetic foot. Foot ulcer also.
Yes.
So neuropathy is almost, if you say like 80-90% of diabetic foot ulcers, they have neuropathy. So neuropathy, initially they might not have any symptoms. As I said earlier, 50% of nerves should be damaged to experience symptoms of neuropathy.
Yes.
So if you test with monofilament, and there are other things like touch sensation, temperature sensation, ankle reflex, tuning fork with which we test vibration. Among all of them, the best is monofilament. Monofilament, yes.
Sir, first thing, when a patient is suffering with diabetes, so the circulation gone down.
Yeah.
The blood circulation got reduced. And when the circulation got reduced, what is the reason that circulation got reduced?
So in diabetic patients, especially those in whom it is not controlled, and those diabetics who have hypertension also, and those who have a bad habit of smoking. So diabetes, hypertension, smoking, and the other fourth villain is dyslipidemia, that is bad cholesterol.
Okay.
So all these guys, they help in atherosclerosis, that is fat deposition in the blood
Blood
vessels.
vessels.
And the blood vessels going to the foot or the lower limbs, if they get occluded, the sad part in diabetic patients is that it gets occluded at multiple levels. So if there is one block here, there is one block there, one box somewhere
Okay.
else. So
Okay.
it's almost like a clogged drain pipe.
Yes, yes.
So people will have symptoms of reduced blood supply, and some people can develop collaterals also. So God is helping in them in that way.
Okay.
But unfortunately, those collaterals might or might not be enough. So what happens is people will develop pain while walking because the
Okay.
muscles don't get enough blood supply while walking. So that is known as vascular claudications.
Okay.
So intense pain in the calf muscles or thigh muscles, it depends upon where the artery is blocked.
Okay.
So these muscles release lactic acid, and that lactic acid causes pain in the muscle. So pain on walking in the muscles is a sign of reduced blood supply.
Okay.
If that progresses to some stage, people can have pain just while sleeping or even while sitting. So that is known as rest pain. So these two symptoms patient might experience.
Okay, sir. How do you treat this kind of things?
Yeah.
Is there any kind of medications you
So
prescribe?
we should, first thing, as I said, diabetes should be quickly brought under control. Patient should be asked to quit smoking, not decrease smoking.
Yes.
Strict abstinence from smoking.
Mhm.
The other is blood pressure control, and the other is control of bad cholesterol. So this, what it will do is, it will not reverse the problem. It will at least halt the problem there.
Yes.
And we should do a Doppler study also. We can see how the blood supply to the foot is affected and how severe it is. And sometimes we can measure toe pulsations also.
Two pulses.
Toe pulsations, systolic pressure at the toes. And Doppler is quite inexpensive thing, and it's a non-invasive thing. It's quite easy to be done. And if we see recommendations, any diabetic patient beyond 50 years should get Doppler done
Okay.
every year.
Okay.
So this is not practiced. People do all tests, sugar, lipid profile, urine, creatinine, but after 50 years, all diabetic people should get Doppler test done, because, as I said, blood supply, if it is decreased, patient may not have any symptoms.
Yes.
So in order to identify earliest, it is possible only through testing.
Testing only.
Testing only.
So depending on the testing, after the result only, we'll go for medications.
Medications. So the medications will definitely include some for the cholesterol, and if there are too many blocks, blood thinners will also be useful.
Okay.
And if you feel that the patient has symptoms which are not decreasing with just medical treatment, then probably vascular surgeon will also have a helping hand in such situations.
Okay. Sir, if a patient is suffering with tingling sensation or numbness on the foot,
Yes.
can you tell that the patient is suffering with diabetic foot issues?
Yes. So tingling and numbness indicate that the nerves are damaged
Okay.
beyond 50%.
Beyond 50%.
Beyond 50%, because if more than 50% nerves are there, patient will not experience numbness.
Okay. Okay.
So tingling and numbness, they might be very less severe to the patient. Patient might say, sometimes I get numbness and all. Sometimes my Hawaii chappals, they slip away, I don't recognize. But it is very bad sign and symptom, because such foot is at a very high risk of developing ulcerations.
Okay. Okay.
Yes.
So if a patient is suffering with tingling or numbness, so immediately they should consult a endocrinologist and take the medicine.
Yeah, they should consult an endocrinologist, or at least their treating
Yes. Yes.
doctor.
Yes.
And people should examine their feet regularly, because the gift that pain is a gift.
Yes. Pain is a gift, right?
Pain is a gift. It is helpful. If it was not for pain, we would have
Yes.
got all our legs amputated and like that. So pain is a gift, because diabetic people with neuropathy, they don't have pain. If there is some injury, they don't perceive it.
Yes. And it leads to ulcerations.
Yeah.
The
And even if they develop ulceration, because they don't have pain, they think it's normal. It's okay. What's the problem in having an ulcer if it is not painful? So that's the reason why they don't come to the doctor.
And sir, the patient, what I have seen, a lot of patients those who are suffering with charcot foods, the food is totally disturbed.
Gone. They don't have any pain.
No pain, and they told it's okay. I'm not getting pain, so
Pain.
I think I'm okay.
Yes.
But the condition is very poor.
Very
the
poor,
food is
yes.
totally disturbed.
We
and
cannot
it's
salvage such foods.
salvage the food. But though the pain is not there, they're thinking that it's normal.
It's not.
Nothing
yes.
is there.
So what happens in that scenario is ultimately some of those ulcers get infected, and if it is left like that, it will go to the bone.
Yes.
And once bone is involved, bone is a very safe site for bacteria.
Okay.
It is not easy to eradicate infection from the bone. Patient need long-term antibiotics. They need surgery. That bone and everything should be taken off. Bad bone, the dead bone.
Okay.
So bone involvement is a totally different level. So that's why we see for bone involvement or not. And we say that if before the bone is involved, you go and meet a good podiatrician.
Yes.
To take offloading chappals or shoes. But seldom patients listen. I've seen very rich clients who have ulcers, but they don't go because they say that so those shoes are not very cosmetic.
Yes.
They're not very attractive. I can't wear them to parties. So I say that
saving your leg is important.
Saving your leg is more important rather than going to parties. So first health, then other things.
When I were a student, that time my teachers always told me, when you meet a diabetic patient, always tell them that their food is more important than their face.
Yes.
So clean the food as much as possible and make proper cleanness should be there.
Yes.
And proper precaution, what kind of footwear you are using. You should compromise on your shirts or pants, but should not compromise on your footwear.
Yes.
That was advised by my teachers, and I also advised to my patients also. So
footwear is important, but foot is unfortunately most neglected part of the body, and foot is not. It's more important than face. Foot is like a baby.
Yes.
We should take care of foot like a baby.
Baby. Foot, because total body weight is coming on the particular areas.
Foot, yes.
Particular areas, and while walking, so many things is going on because we are not the common people, or even we also don't take care.
Actually, in normal people, the foot is able to take care of itself only.
That's why we are here. We are here to make them aware about why they should take care of their foot, and if they will not take care of the foot, then they have to come to the doctors and going to the hospitals regularly for the treatment of his foot, for the foot. Sir, sometimes the patient, those who are suffering with the diabetic foot, what we notice that their skin condition and the food temperature, the body temperature different, the food temperature different, that changes. So why it changes and what are the problems involved on that?
Yes. So proper blood supply is very important for the condition of skin. Previously, when there were no tests, old time doctors, they used to just see face, they used to see nails, skin.
Yes.
So skin will give a lot of information about the blood supply.
Yes.
So normal skin is moist. It's not too moist, it's not too dry. The patient with neuropathy or those with compromised blood supply, the skin will thin.
Yes.
The fat that is present beneath the skin is gone.
Okay.
So that skin has a very particular appearance of that glossening, shining.
Okay.
Shining appearance. It's like a tissue paper. It's very thin.
Okay.
And the hair is gone. Hair is not there. So that's why diabetic people, if you see the leg, there is no hair.
Okay.
So loss of hair on the leg means that blood supply is going down. Normal nails, if you see my nail, it's like this. If you see some diabetic nail, it's brittle.
Yes.
It's thick. it doesn't have this shiny quality. It loses its luster,
Yes.
and it is separated from its nail bed.
Yes.
It gets separated from its nail bed.
Mm-hmm.
It's brittle. So these are all early signs of diabetic person developing less blood supply. So the foot is typically somewhat cooler than the body. But if there is Charcot's foot or active Charcot's foot, if there is cellulitis, and sometimes paradoxically in diabetic patient, if they keep the foot up, it will become cold. If they keep the foot low, it becomes very hot.
Okay.
So that is dependent rubor and pallor on elevation. So redness while you keep the foot down,
Yes.
and it becomes pale when you keep the foot up. So that is again a sign that blood supply is decreased. But if the foot is red hot,
Mm-hmm.
think of Charcot's,
Okay.
think of cellulitis, infection. So
Okay.
these are two important things.
Okay.
So foot throws a lot of light on the blood supply of the foot. Of course, we definitely look for pulses. We'll see the pulses of the foot as well as the other places where we see whether pulses are normal or not.
Okay. So just now we have discussed about diabetic foot symptoms. So now we are going to discuss about few things about what are the precautions that a diabetic patient should take care for that
Yes.
for his foot.
Yeah, so diabetic patient, he should be very cautious in taking care of his foot. So the best thing is to regularly, daily examine the foot
Foot
and see whether there are any cracks,
cracks. Mm.
especially the area between the toes.
Toes.
Is there any ulcer?
Okay.
Is there any deformity?
Okay.
How is the condition of the nails?
Okay.
Are the nails neatly cut?
Mm.
Is there any callus formation? Because
Okay.
callus is a pre-ulcerative condition. So it is there before an ulcer is there.
Mm-hmm.
So ulcer will not develop just like that. There should be a callus on pressurized areas or dependent areas, weight-bearing parts of the foot. That callus, because it doesn't have proper nerve supply, it develops into an ulcer. So
Okay.
callus, if it is there, it should be excised. And people can also check their sense of touch. They can use monofilament also.
Okay.
So these are few things that people should take care of. Especially look for cracks, any sign of infection, and the other thing is they can take care of their foot by applying a good moisturizer.
Good question.
Every time.
How in a day, how many times they should clean the foot? Is there something like that?
So there is no guidelines like that, but what people say is that whenever you go outside and come, you clean the foot. It is not that you put your foot beneath the tap water and you come and just wipe it over the mat. It's not like that. So wiping is okay, but you should take a dry cotton towel
Mm-hmm.
and in between the digits, you
Yes.
make sure that you keep it dry.
Yes.
And while wearing socks also, we should change. It's common habit in India that people wear socks for the whole week. They don't
Yes.
change socks.
Yes.
So they retain a lot of moisture, they retain a lot of bad odor.
Okay.
They keep changing their socks daily, and they use only cotton socks. And the footwear should also be very important. We can discuss about the footwear in the
Okay.
coming few minutes.
Yes.
Yeah.
So, suppose a person is suffering with diabetes. So, how important to control the blood sugar so that we can control the diabetic foot?
Yeah. So, blood sugar control is very important, not only to prevent, but also to treat once diabetic foot develops. Because if you are controlling blood sugar levels effectively from day one, it means that the chances of developing neuropathy and subsequent diabetic foot is very less.
Yes. Okay.
But practically this doesn't happen. So many people end up in diabetic foot. Once they develop diabetic foot and they don't have good sugar levels, the sugar can promote bacterial growth
Okay.
in the ulcer. So that's why people who have ulcer and have poor glycemic control, they develop wet gangrene, that is infection of the soft tissues,
Yes.
and there will be a lot of smell, pus from the wound, and this might threaten the viability of the foot also.
Yes.
So diabetes control is not only important to prevent diabetic foot, but if diabetic foot is developed, it's also important to prevent infection in
Okay.
that ulcer
Okay.
or cellulitis. So it plays a very important, crucial role right throughout the course of diabetes.
I have a small doubt, sir. How do you differentiate cellulitis and ulcers? Is there any?
Cellulitis, the skin is intact.
Okay.
So there is no breakdown of skin.
Okay.
There will be signs of infection like redness. Patient will have fever. Patient will have pain also.
Okay. Cellulitis.
In cellulitis.
Okay.
Whereas in ulcer, patient may not have pain because ulcer develops in the patient who has lost pain.
Yes.
So there can be some pain, but most people will not have pain. So it is basically a painless ulcer.
Okay.
And ulcer develops on dependent areas.
Where the pressures are coming more.
Ulcer by definition, it means the skin is gone. Skin and at least some of the tissues below the skin are damaged.
Okay. So basically, the pressures where the pressures are coming more, the ulcer from that particular place, or if patient is not walking on that condition, ulcer forms.
No, patient if is not walking, ulcers can still form on the dependent areas. Suppose if the person sleeps,
Okay.
suppose we think if it is the heel, these are the toes. He keeps sleeping like this. He's bedridden for many months. He can develop ulcers there. That is
Okay.
quite an unusual location.
Okay.
But take the example of a normal person who walks. So when we walk like this,
Okay.
we put our heel first,
Yes.
then the entire foot on the ground, and once we want to take the foot off the ground, we stand on our toes and then
Then push
take
up.
the next step.
Yes.
So the areas, the heel, where the junction between the toes and the foot, so that is known as the
Arching.
metatarsal heads. So they are the areas where, and the distal part of toes. So these are the areas where pressure is high.
Okay.
And this is typically where neuropathy predominates. Ulcers develop in that place. But if somebody develops, the nerves are normal and the blood supply is mostly affected, then they develop ulcer toward the end of the toes.
Okay.
So that is not neuropathic ulcer.
Okay.
That is because blood supply is gone. The last part of the body is most affected. So that is the tip of the toe.
So,
So that's the unluckiest part. So where they have developed ulcer because blood supply is in there.
okay.